realised when my little baby Allegra was about 6 weeks old that I wasn't right. I know it can be really hard as a new mum. You're not getting much sleep, you feel a bit overwhelmed and you can't believe what's happened to your life. But I knew that the way I was feeling was very different.
Definitely those physical sensations of fear, sort of shuddering through your body, and just distressed and uneasy, and just feeling that really simple things were just beyond me. Postnatal depression, it's a complex, cross-cultural form of major depressive disorder. It's not considered clinically completely separate from other adult forms of major depression in terms of diagnostic categories, but in reality, in the practice of looking after women who suffer postnatal depression, it has quite a different clinical appearance. It affects about 15% of women and is in fact the commonest complication of pregnancy, childbirth and in the postpartum period. It's more than a bad day or a bad few days. And thinking about changes that have been in place for, say, longer than a 2-week period. The beginnings of postnatal depression can be very subtle and hard to pick up, and not that different from all the changes that happen after the birth of a baby anyway. Lots changes, there's a lot of emotion, there are a lot of challenges anyway for all new parents. There are 2 peaks. So there's the initial period shortly after the birth of the baby in those first few weeks, which appears to be a high risk for women, and then approximately 6 months postpartum. That presents its own set of issues because often there's been a significant time gap from birth and people don't think about the onset of symptoms as being part of a depressive picture. Clinically, the things that one would be concerned about if one saw a mother is someone who's obviously not enjoying her baby, somebody who's not able to sleep when the baby's sleeping, someone with a lot of cognitive ruminations that, they're not a good enough mother. Her appetite might change, she may feel a lot of physical pain. Certainly mums from a range of different cultures talk about physical pain when they're actually talking about depression. Agitation and chest pain, anxiety, heart pain, feeling breathless, headaches, those kind of things can be very much part of anxiety and depression. Psychologically and emotionally, there can be a lot of anger, crying or not being able to cry, irritability, feeling very low, poor motivation. One of the main changes that can come is with what we call cognitive skills, so memory problems, concentration difficulties, difficulty making decisions, feeling quite confused. And then socially, it can be not wanting to be on their own, so not wanting to be at home, wanting to be with other people, or withdrawing from family and friends and kind of everything in the middle. The Edinburgh Postnatal Depression Scale is commonly used to screen for the potential for depression and anxiety. It's not what we call a diagnostic tool. So it's 10 questions that mums are asked to fill in once during pregnancy and once after the birth of the baby as a minimum.
and it's scored to provide some indication that this mum needs further exploration for the development of depression and anxiety, and that would be an appointment with her GP or ongoing support from the healthcare provider. Alongside the Edinburgh Postnatal Depression Scale, it's important to talk to mum about what we would call psychosocial risk factors as well, and whether that's through another questionnaire or an interview can help inform the actual risk that mum is experiencing for depression and anxiety, as well as what kind of support she's going to need to prevent depression and anxiety. Perinatal depression is a word that's used now to encompass from that period of conception, so at the beginning of pregnancy, to the end of the first year after birth, and it does include both anxiety and depression.
One of the things that I think is useful to think about is that it should be considered more perinatal depression. 50% of cases of postnatal depression are present antenatally, and that's the focus of our assessments. A lot of those cases aren't actually diagnosed antenatally, but clearly they're present when we study them in reverse, and it would be really important for future improved clinical care to pick up those cases. Fathers actually also suffer from postnatal depression. In becoming a father, there are significant changes within their own identity, social structure, their relationship with their partner, and financial considerations which can impact more heavily on men in terms of worrying about another person to be responsible for.
If I look back, I knew there was something wrong, but I just didn't know. I just wasn't aware. I knew there was something wrong between us, and maybe I thought it was between us, but in fact it was something wrong with her. She was unwell.
I look at my daughter and the guilt really kicked in, and I thought, well, she's such a beautiful little baby. I couldn't have asked for a healthier little baby, and yet why am I feeling like this?
In our community, there are a lot of expectations that motherhood is going to be the be-all and end-all and a wonderful time, and when that expectation is not met, women are often reluctant to acknowledge those feelings within themselves or talk about it to other people for fear of being judged or considered to be inadequate or not a good mother.
The complex biopsychosocial interactions that occur with pregnancy, delivery, breastfeeding, and all the concomitant changes that occur in your life. And it's really one of the biggest changes somebody can make in their life, and that's often not appreciated when people are looking forward to the birth of a baby. They're thinking about all the things that they're going to gain, and less impact is put on the losses that occur, that often women are leaving their job, leaving financial security, it's a different friendship group, the relationship can change, and all of that has the potential to have a positive outcome in the end, but often those things aren't appreciated and can really impact quite heavily in an unexpected way.
What we know about perinatal depression in its occurrence across the community, it doesn't respect any boundaries. It occurs regardless of age, financial security, religion, culture. It occurs for virtually any type of person or in any type of community. Having said that, there are some risk factors. So a mum that's very young or a mum that's much older at the time of giving birth is more at risk. The family are not in secure housing, or there's a lot of conflict, a lot of relationship conflicts that can occur more predominantly. Unplanned pregnancies can be a real shock to a family or to the mum herself. Low levels of social support, having a history of depression or mental health problems either yourself or in your family, that is a major risk factor or a major cause. Also low levels of emotional or otherwise support, use of drug and alcohol that can exacerbate any predisposition or pre-existing conditions, or even mild conditions becoming more severe. Having a baby notoriously brings up old stuff. Could be trauma from childhood childhood experiences, particularly sexual abuse, is really linked to a difficult time as a new parent, but also difficult family relationships can come to the fore. So if the new mum has a difficult relationship with her own mum, then that can really bubble away and be on her mind. And that can also be happening for dad as well. Picking people up during pregnancy is becoming much more of a focus because of the impact that can have after the birth of the baby. So it's not a foregone conclusion, but the link is very strong.
I definitely got to a point where I felt like I can't live like this anymore. I didn't want to die, but I didn't want to live like that either. And that was probably the hardest, not knowing what to do about it.
The earlier perinatal depression is identified, the lower the cost, the faster the recovery. If it's allowed to continue for many months, and for some men and women for years, it becomes a long-term mental health issue usually. But alongside of that is a family that will continue to struggle, and the relationship between the parents will struggle. It's a really difficult way to start a new family or a child's life, and it will stay difficult.
If you're concerned about someone who might be experiencing postnatal depression, the most important thing to do is to talk about it. Just like if you were concerned someone was struggling with a physical health problem, you would ask them about how they're feeling, you'd take the time to listen to them as they describe what their experience was like. You would help and encourage them to seek information, and you can be quite proactive around doing that. And certainly we have high quality information available around postnatal depression.
There's a lot of psychological therapies that are useful, certainly looking at the symptoms that the women present with and any particular ruminations or negative cognitions that they may be experiencing. It's really important to tease those out and look at some cognitive therapy approaches, supportive psychological therapy approaches. There's also a lot of supportive and educational therapies that are really important in terms of explaining to women, this is a common disorder, and that it's not that they, shouldn't have chosen to have a baby or that they're not a good enough mother. So a lot of those supportive therapies, of course, any practical help that can be provided. Often women do need a lot of support from family and friends, particularly with severe depression as they gradually become more dysfunctional. But all of those things combined are really the most effective approach rather than picking a treatment. It really is a multidisciplinary therapeutic approach. There's no set medication that one would prescribe for a depressive illness. It's really important to look at the factors affecting each woman in terms of her medical history, the current symptom, presentation, and how severe the illness is. In a more general sense, we often use what are called the SSRIs, the serotonin selective reuptake inhibitors, as they basically do increase the levels of serotonin, which is associated with an elevated mood. It's used to augment other forms of treatment, and certainly it can help in reducing anxiety and allowing women to process and think through the situations that may in particular be distressing to them. There are side effects to any medication in pregnancy and if women are breastfeeding. The SSRIs are relatively well tolerated and seem to be effective in lower doses in women when they're put into a multidisciplinary treatment program. As clinicians, we really never want to prescribe medications if we think that we can manage without them. And in every case, we always weigh up the advantages versus the disadvantages. I think it is important for women to understand if they are suffering a severe depression, for example in pregnancy, that also has impacts on the fetus. One of the things that I think we need to do is really make sure that we train health professionals, and a lot of people who come in contact with women, to look through sometimes that mask of I'm fine, everything's fine, there are no problems, when in actual fact, that woman is really quite distressed but not feeling confident enough.
It's a depression or anxiety process that parents do recover from with good support and treatment in a range of different ways. Recovery is usually complete, and they don't go on to experience any other form of mental health issue later in life. Treatment isn't always about medication. It can be lifestyle changes as well, eating well, exercising, having a break from the baby and older children, being supported to follow your hobbies and your interests. Lots of new mums and dads cease all their own interests after the birth of a baby and don't find time to do the things that made them happy.
I felt fine during my pregnancy. I was still the same happy, daggy person through my whole pregnancy and was not aware that I was going to have any problems afterwards. The first signs that something was wrong is that my behaviour just started changing. My mood was very flat, and I'm a very bubbly person normally, and there was no joy in anything. The symptoms can be completely different for different women, so mine personally pretty much encompassed nearly all of the symptoms you can get all in one hit because it was quite severe. It included just helplessness, complete feeling that nothing is right, nothing's ever going to be right again, nothing's going right, I'm not doing anything right. It was guilt because I wasn't managing looking after a baby, which I was completely managing fine, but to me it just felt like I wasn't doing a good job. The forgetfulness, concentration, I couldn't even concentrate on finishing a sentence. If you asked me a question, I wouldn't even know how to answer it. Just crying all the time. Sometimes I would sleep, I couldn't get up for just being so tired, and then there were other times where I couldn't sleep. I was up for ages, and I'd be up all night and I'd wash the floors and things like that, and I couldn't go shopping, I couldn't be in crowds. My husband was just completely lost. He was like, where is my bright, bubbly wife gone, and who are you? My friends couldn't understand why I wouldn't get in the car and come and visit them, and I didn't even know why. For me, it was definitely an unrealistic expectation of motherhood, unrealistic expectations of myself to be perfect. There was the expectation of the whole pregnancy and the birth didn't go according to plan. Then after having the baby, I was quite sick after I'd had a cesarean, and again that floored me because I didn't expect that either. And after several sicknesses after having the baby, I tried to go into supermum mode. People joke about that, this baby didn't come with a manual, but it's absolutely true, because you get it home and you're like, oh, how do I change the nappy, or how do I put it in its car seat before you even leave the hospital, and all those things. And so you think that, well, my parents must think I should be able to do this. My in-laws, what are they going to think if I look like I can't cope? And especially with cultural differences, the length of time it took me to work out there was something wrong was way too long. I just thought, how could I possibly have depression? I'd never been depressed a day in my life, didn't even know what it was, never had anxiety. I went to the doctor and told him about the symptoms and said I'm having trouble remembering things, I'm crying all the time, I'm angry at my husband, and he turned around and said to me, aren't all women like that? So that just floored me, set me right back, and I went home and I tried to bury it again. And it got to probably about 6 months, which is way too long, so I got progressively worse. My mum finally took me to a psychologist who specialised in PMD, and they had me in hospital within about 3 days in a mother and baby unit with my baby. Going to the hospital was very helpful because they were very reassuring and comforting, going, this is not you, this is an illness, you're not going crazy. Explain the medications. It took a very long time for them to get the right medications for me. They tried me on one thing that didn't work. They finally came up with a combination of about 3 different types of medication, which started to even me out a little bit, and with that and sort of counselling and teaching me how to look after the baby, even because by that stage was probably still feeding every 3 hours, and this is 6 months old, feeding every 3 hours and not on solids or anything, so helped me get him on solids and helped me comfort, settle him rather than pick him up every 3 seconds. Once I got back home, I still had regular visits with the psychologist, regular visits back to the hospital with the baby just to make sure, like everything was still going okay. Everybody was watching out for me. And I had home help as well, so someone came over and helped with the menial tasks that you feel guilty over because you haven't done. My husband and I both had counselling together, so it helped him understand, which was really helpful. Like, your wife's not going crazy, this is an illness. And the ongoing medication for probably about a year to 2 years after that. Health professionals really need to be aware of the symptoms and be watching out for women. Women need to be validated that what they're experiencing is real and it is an illness and it's okay, it's not your fault. Just say, yes, this is something that happens to a lot of women and there is help and you will get better. The earlier you get it, the quicker and easier your recovery is. That's proven, that's medically proven.